This conference will now be recorded.
Oops. Okay. I want to acknowledge some of the collaborators and some of our funders. Dr. Mickey Iris, who passed away earlier this year, was so encouraging and so helpful to us. Mickey was well known in APS in the state of Illinois. We've had funding from a variety of folks, but we've had a great partnership with the Michigan Adult Protective Services. And really, Marie Ship and Terry Brewer have been incredible champions for us. Here's what I want to do. I want to describe a little bit of our methods and the framework, just review a little bit of the studies that we've done. It's important that this is an evidence-based approach. And then talk about, for most of this, our training and implementation and how we've engaged with APS of Michigan for bidirectional communication, the addition of supplemental material, go through our decision tree, our user guides, describe our website where there is narrated online training and certification, all of this for no charge for anybody. I think this is the key question that any of us that are working in elder justice think about. How do we balance protection? If we underprotect people, that can lead to gross financial exploitation, and that can really impact every aspect of their life, including their longevity. If we overprotect, however, because most people have strong needs for autonomy, when they still have capacity and we unnecessarily limit autonomy, it not only leads to lower quality of life, but can also really impact longevity. If you think about financial exploitation, it is really the other side of the coin, or the dark side of financial capacity, often, because there's some interaction between the older adult victim and another trusted person. So I'm not talking about identity theft or even straight theft, but really where there's this relationship and some financial decisions have been made. Ken Conrad, Mickey Iris created an older adult financial exploitation measure. And these are the 6 domains that they created. Thefts and scams being the most serious. That's where the money is lost. But the next 3 are really important. They are the mechanisms by which much of this exploitation takes place. Abuse of trust. And abuse of trust, we will see, happens not only within families or friends or in stranger scams, but in every profession that we look at where finances is dealt with. We can see that there is of trust. And we'll get into that in a little bit more detail. Financial entitlement. I think this is a very important concept to be thinking about. That is, a lot of adult children who exploit their parents think of their parents' finances as their own, because now they're taking care of their parents and they see this as, well, this is going to be my inheritance, so I'm just using it. They feel entitled. You and I call that theft, and it is, but those boundaries get blurred for some people, and it really is one of the mechanisms by which there's significant exploitation. Coercion is a little bit more, think of undue influence, a little bit more kind of away from the public, where people are really pressuring an older adult, especially a vulnerable older adult, to make certain decisions and basically strip their free will. And then the last 2 are really risk factors for exploitation? What are the signs of possible financial exploitation? People have been asking for money. Have there been pressures that you're getting? And what are the money management difficulties? Are you starting to make mistakes in paying bills, forgetting to pay your taxes, and so forth? Now, we also did some work on a nationally representative sample, one of the first, about self-reported fraud between 2008 and 2012. Our publications came out in 2013 and 2016. First thing that we noticed was that the self-report of fraud jumped 22%, from 5% to 6.1% over that 4-year period. And I think, you know, we know that people are more likely now to report this. It's becoming a bigger issue, a more public issue, but I think that's also the case that we're finding that there are more fraud cases. So we looked at those new fraud cases and we wanted to see what is the strongest predictor. Now, this was a cognitively intact national sample, and really we found psychological vulnerability to be a big predictor. And in the 2013 sample, it was 3 times the rate. So I always say all of us are susceptible to being scammed, every single one of us, under the right circumstances. But some people are more susceptible than others, and those with the highest sense of depression and the lowest sense of visibility through their lack of status, their perception of that, had 3 times the rate of being scammed. In 2016, when we just did the longitudinal follow-up with the new sample, we found similar results, and now it was twice as common. So we decided, hey, there really is no person-centered scale that asks people about specific financial decisions that they're making and gives us the opportunity to measure their capacity about that decision. Ben Mast, my colleague, we used his whole person dementia assessment approach, which really integrates the idea of person-centeredness with standardized assessments. So kind of 3 things stood out for us. Context matters. It's not just about the intellectual part of it, but what's the context within which I'm making a decision? The voice of the older adult is critical, and we want to focus on real life decisions, not vignettes. So what does context matters mean? And this perceived financial vulnerability, these items are, this is a new release of data we submitted to the Health and Retirement Study, a block of questions, and they approved those for a data collection in the 2018 survey. And they just released these data. And it really is telling about how people perceive their own financial vulnerability. 2/3 are at least sometimes anxious about financial decisions. Over half wish they had someone to talk to about finances. About 1/3 are worried that someone will take away their financial freedom. And 1/4 are not confident in making big financial decisions. And then we can see that almost 1/3 are treated with less courtesy and respect during financial transactions, at least sometimes. So that's what context matters. How do we feel about our own financial vulnerability? But then when we look at decision-making capacity, we have to look at the groundbreaking work of Applebaum and Grisso. This was originally designed for capacity for psychiatric treatment when the guardianship laws changed in the 1970s. And then health decisions followed. And now we're making the case for financial decisions. It used to be that all you had to have was a diagnosis. Let's say Alzheimer's disease or schizophrenia or bipolar disorder. If you had that diagnosis, then somebody could go to the probate court and say, this person needs a guardian by virtue of the fact that they have this diagnosis. Because of the mental health laws and advocacy, that got replaced. And it got replaced by aspects of informed decision making. In other words, just because I have schizophrenia or Alzheimer's disease doesn't mean I cannot make an informed choice. I need the opportunity to be asked about that choice and to demonstrate that I can make that or not. And what does that mean? Well, there's 4 aspects of decision making. The person has to be able to communicate the choice that they want to make, an understanding of that choice, an appreciation of the possible consequences or risks of that choice or impacts on others, and they have to be able to reason and have a rationale that's not delusional. Those are the 4 underlying aspects of most guardianship laws, actually, and most contract laws and testamentary capacity laws. And so Applebaum and Grisso's enunciation of these really allows us to say, okay, how can we measure those? So in order to do that, we wanted to create a scale, and we used the same method that Ken Conrad, Mickey Iris, their colleagues used, which is a concept mapping model, where we basically had experts work with us. We had 2 expert panels, 6 were national experts from across fields of medicine, psychiatry, social work, psychology, and 14 were local and worked directly with older adults, including APS and bankers, and financial planners, etc. And what did we come up with? Well, they really, this group was exceptional. We started out with open-ended questions, but based on their extensive feedback, we finished with a longer scale of 66 items in total, all multiple choice, but also a 10 items screening scale, and then a 34 item complete scale as well. So that's what we have and we're going to talk about. Here's the conceptual model. You can see in the middle the intellectual factors. This is the Applebaum and Grisso values of choice, rationale, understanding, and appreciation. And to the left of that are the contextual factors: financial awareness, psychological vulnerability around money, and then susceptibility or relational conflict. And all of this is looking at the integrity of the financial decisional ability. Is this an informed financial decision or not? So these are some of our publications for our longer scale. So it's important that things go through peer review. But I really want to talk about why we did this and how it can be helpful. First of all, we created this scale in one sense because it's person-centered. We wanted to promote autonomy wherever possible. And I want to give you these 4 examples. The first one is an 84-year-old man who suffered an injury. He had a bad fall, and he was in rehabilitation. And his power of attorney was his nephew. And this fall was very bad and very serious. And his nephew saw that perhaps this gentleman, his uncle, would not recover. And so he stashed him in one of the most destitute apartment projects that I've ever seen. Now, this gentleman had lots of money. He'd been a very successful businessman. The nephew also stole his phone. But fortunately, this man was resourceful enough that he was able to have someone in the building let him borrow a phone, and got in touch with his attorney. And his attorney asked me to go out and evaluate him. And sure enough, although he had some mild cognitive impairment, he definitely could make informed decisions about his power of attorney. Now, it so happens that I saw this gentleman, he just died this year, throughout several times across the years. He got better. He went home. He lived a very full life. His choice of a power of attorney was outstanding, and he did very well. So we have to be careful that we don't overlook the strengths of people. This 82-year-old woman, for example, she saw a neurologist. She was diagnosed with mild cognitive impairment by her neurologist. The woman's nephew called up the neurologist and said, "Oh, our aunt is no longer changing her clothes. She's not using the toilet correctly. We need a letter from you to say that she has Alzheimer's disease and needs a conservator." The neurologist went ahead and did that. Now, the woman just happened to run into an elder law attorney who she used to work for, who was visiting a different resident, and told her story. And that elder law attorney asked me to go out and evaluate this woman, who continued to have mild cognitive impairment, but was functioning at a very high level and certainly did not need a conservator, promoting autonomy, again, through use of these scales. So the last one that I'll talk about is a 90-year-old man with mild stage dementia. He definitely had dementia. But it was interesting, his insights, he wanted to change his will to benefit his only daughter because his stepdaughter was financially exploiting he and his wife. And he was able to talk at length about his daughter's situation, including the fact that he was helping her with a monthly stipend at this time. He's since died, and the will was probated and successfully was not challenged. So those are really important stories about promoting autonomy. That's why we want a scale that will tell us, do we need to protect somebody more or less? So we formed these 3 new scales, and they have different names depending on where you're looking at them. If you're looking at the literature, the Lichtenberg financial whatever scales, but if you're looking on our website, it's the financial decision tracker, the financial vulnerability assessment, and the family and friends informant scale. Now, this is the 10-item tracker. And these 10 items are part of the rating scale. And you can see they're all on one sheet. So if you need to use a PDF as opposed to administer it online, it's easy to do. And you can see some of the questions there. We'll look at them a little bit. But this is the screening that we've been using with Adult Protective Services, particularly in Michigan. And again, this has been an evidence-based scale. So the article in the middle talks about reliability and validity of that 10-item scale. And then the article above that talks about, on a new sample, an APS sample only, how did that scoring system work and how did it relate to the judgment of the APS workers? So we took the evidence base and we wanted to go into a statewide implementation. And we knew that, it's one thing to have evidence-based tools, but they're not always so straightforward. So it's another thing to then begin to use them in practice and to use them appropriately and successfully. So our goals began with, we wanted to use our online training system to have all Michigan APS workers trained and certified on using both the 10-item financial decision tracker and the family and friends interview, which is 14 items. Our strategy was to do something similar to this. Either I was in person across the state or webinar, depending on the area and what they preferred. And we gave a similar kind of training, a little bit about the background of this question. Why are these kinds of scales important? Capacity comes up over and over again in APS exploitation cases. How can you assess it? And then the improvements to the system post-training allowed me to then review each scale that was administered. And I could send inquiries to the staff and the supervisors for cases that I had questions about or that didn't seem to be used appropriately. Here are the questions. What's the decision you're making? Now remember, these are all multiple choice answers, but this is relating to choice. Was this your idea or did someone else suggest it or accompany you? We wanted to get a couple questions that get to the autonomy of this choice. What is the purpose of your decision? That's the rationale. Is it for your own peace of mind? Is it to gift somebody? Is it to gift an organization? What is the purpose? What is the primary financial goal? Are you trying to make money, share your wealth? What are you trying to do? That's an understanding. Also, how will this decision impact you financially now and over time? Do you understand kind of the impacts? How much risk is involved? That's appreciation. How may someone else be negatively affected? That is to say, if I am talked into changing my will so that I'm going to leave it all to Wisconsin APS, do I appreciate the fact that my children won't be receiving any of my estate? If I do, well, that shows that I have better informed decision making. But if I don't, which often happens when there's cognitive impairment, I don't link those two things up, then I may be lacking in appreciation. Who benefits most from this financial decision? That's an understanding question. If I'm a grandmother and I buy a house for a grandchild, even though it makes me feel really good, I need to know that it's my grandchild that benefits most. And that's a common one where we see mistakes made that show a lack of informed decision making, perhaps. Does this decision change previous planned gifts or bequests? And that's another appreciation. And finally, to what extent did you talk with anyone regarding the decision? Again, looking at the autonomy. Our initial partnership between 2015 and 2017, the scale was all paper-based, and there was no scoring or feedback given to APS staff. So that's how we validated it. They used the scales, made their own judgments, and then we looked at what our scoring system looked like. But we also got great feedback from some of the supervisors, and you can see some of the changes that we made with the reminders of the instructions and some other bullet points on the scale. Number two, though, we worked with the APS Deputy Director, Terry Brewer, and his leadership team. And one of the sector supervisors in Michigan, there are 5 or 4 business services sectors. The state is chopped up into 4 big areas, and some of them have multiple counties, obviously. Well, one of them agreed to work with me to implement the scales with his team. And that's how we were able to publish with larger sample sizes and the cross-validation. And that positive appraisal led to support for the implementation study. So you can see this is step-by-step approach. And here's what we wanted to do. So the first 3 months of our implementation, we wanted to meet with and have all supervisors trained and certified, certified, sorry about that. So we wanted to start with supervisors because if they didn't really understand what the training was all about, there's no way that they would be able to direct their staff to undergo the training. The second 3 months, we had the APS professionals in the field trained and certified, and the implementation began. And the last 6 months, we started reviewing all the cases. So I met with each of the 4 groups of supervisors first before they were trained, and afterwards for feedback, and met with the whole staff in subsequent months as well. Here is the landing page on Older Adult Nest Egg website. A few of you have created accounts already, but most haven't. And what you can see on the top right is a sign up button, and that's where you can create an account. That'll give you a drop down, and you fill it out with your contact information, email, and it will create an account for you. Then you want to get certified. So you scroll down to the bottom of the home page and click Start Training to use the interviews. And then you select the tools at the a new submenu, Training and Education, and the training below that will get you started. People can't use the tools or gain access to the PDF of the tools until they go through the training and the certification. The certification are 5 multiple choice items. They're pretty easy. Everybody has passed them. And so it's just a matter of paying attention to kind of what's being taught. There's an overview training, and then there are trainings for each of the 3 scales. Now here's what happens when you complete a scale. You might print off the PDF, use it with your client, and then come back and enter the responses into the system. It's a rating scale, so you're comparing. If you look at responses on the right-hand side of the screen, you're comparing what the older adult reports or the vulnerable adult, because we have used this with younger people too, and your sense of the most accurate answer. So what financial decision are you making? And they say investment planning, and then it asks you, do you agree with the respondent's answer? And you say yes. And so that's kind of the way that this scale goes. And it gives you a risk score. So there's a risk rating in the top left corner. You can see that box, and it says no concerns. And then you're the professional, though. You will either confirm that score, or you will say, no, I don't think so. I think there should be concerns. And then it gives some ideas about what that means with no concerns, and whether you should be comfortable based on this score of moving ahead with the decision. There's also, you can see an area for next steps and also resources. So there's some good websites there as well. There are the 4 training buttons, the overview, FDT, FFI, and FBA, that you'll see and click on. Okay, so then we created, based on some extensive feedback from Michigan APS workers, a couple of things. One is a guide to think through when it's best to use these scales, and the other, a decision tree on exactly when to use it. So are we trying to promote autonomy or help provide protection? That's the key question. Here's the 5 decisions that prompt APS to use the scale. In some other settings, there can be a couple of other different types of decisions, but in almost every case for APS, it's been one of these 5 decisions. Is the older adult or vulnerable person giving a gift of money? Or are they making a significant purchase? Are they giving money to a scammer? Are they allowing someone else to access their personal accounts? Or are they having someone take over their finances completely and manage their funds? these 5 will account for over 95% of the APS decisions that we're seeing. Evidence-based tools are important because they're reliable. You're asking the same thing each time. They're replicable. If somebody else comes in to ask at a later date, we can see how well it's replicated, and they're efficient. These 10 items take about 5 minutes to administer, usually 5 to 8 minutes, and to enter into the system takes about 2 or 3 minutes. So it's very efficient. After the first year, over 400 APS workers were trained and certified on at least 2 of the scales. About half of those decided to get trained on all 3 scales. And over 700 scales were administered and entered into the system. Here's what we got when we had a focus group that Marie Schiff from APS led. One thing the supervisor said is, this gives my staff a tool. We have too few of those. Another one, and I thought this was very important, these assessments help me educate my client. So in other words, remember, this is person-centered. So sometimes the vulnerable adult or older person isn't quite understanding or appreciating all of the impacts of a specific decision. And just by going through the scale and talking with them about these questions, the education component can come in. A third person said, my client lost $200,000 through scams, but I was able to save her over $1 million by going through this, educating her and having her accept that she was being scammed. It helps us ask all the questions we need to. So sometimes these questions, we know we need to ask them, but they're hard to remember at the moment. And so by having a scale right in front of us, it helps us to remember, oh yeah, I want to ask all of these. And very importantly, it helped me communicate with other professionals. Remember, if we need to promote autonomy, somebody's scoring in a low risk and we agree with that score, we can provide that to other professionals and say, look, this person still has the ability and their autonomy should continue to be protected. On the other hand, prosecutors, police can really be, physicians who need to do some capacity assessment can really be informed when there are problems that somebody needs more protection by going through kind of the items with them. So that's what is available, and it's free to users because of great support that we've had from different grants. But bidirectional communication, continuous improvement. And that's why I was so happy to respond to Doreen's contact information and question and say, look, these are not simple to just take an evidence-based tool and implement it. So if people would like, I would love to work with the state of Wisconsin to help do so. So we got more input and we created some more tools. And that's what the improvement really is. We're also looking at implementation research. And we're looking at scale usage, the accuracy of scores, the base rates of decision-making, deficits, and so forth. Let's look at the tracker before we go to Maggie and get some of the common ways that people do and don't use the scale appropriately. So this is the decision tree. I sent this out, I think, or Kelly sent this out as an attachment in one of the emails that we sent. Does this case involve any report of financial loss? Usually it's alleged financial loss, or maybe it's already documented, or it's a continuing one. If yes, go ahead, continue down the decision tree. If no, you don't need the FDT. If somebody has lost money because they've been a victim of identity theft, or somebody stole $5,000 out of their account and they didn't know about it, that is not a good use of the decision tracker, because there's no real decision that was made by the older adult or vulnerable person. Are they their own decision maker? In Michigan, if they have a guardian or DPOA, they didn't want to administer the tracker. They recognize that perhaps there's some problems there and there are other ways that that can be addressed, but this simplified it. So they have to be their own decision maker. Did they report financial loss, any of the following decisions? So you'll recognize these 5 decisions again that, and I think we have a category of other as well. So it's got to be a decision. We wanted to remind people these are the ones that account for 95% of the cases so far. And then, do they appear to be a vulnerable adult? What do we mean? I know that in Wisconsin, you guys have a lot of training in cognitive impairment, and that's great, because that's not the case in all 50 states. And so detecting that cognitive impairment is really important. Are they frail? Do they appear to be lost a lot of strength and energy, having trouble getting around? Are they frail? Are they dependent in terms of activities of daily living? That creates a vulnerability. And do they have a lack of control over their own finances? So yes, they may need protection. So you got to administer the scale. No, they don't appear to have any of these problems, but somebody's complained. Well, they may need support for autonomy. So you administer the scale for that purpose as well. Now, if a relative, friend, or caregiver is available, also use the family and friends interview. This is just giving that perspective of a third party. It's 14 items. It's a self-report measure, and it's just giving their perception. It is not, diagnostic in that sense at all, but it helps you to realize, and there's a couple ways you can use that. One way is sometimes it's the person who's exploiting the older adult. You find all kinds of vulnerabilities with decision making and frailty, and when you give this family and friends interview to the exploiter, they paint a very rosy picture of the older adult. So you can show some of the ways they're trying to be deceptive. Other times, it's kind of borderline, and it helps to have somebody more objective who has nothing to gain to give their input. So that scale used in combination can be very, very helpful. And here it is. The first 4 items really ask about decision-making abilities. What type of decision does your relative or friend recently make? How's it going to impact them financially? How much risk is there? And then the rest of it is really some of those contextual items and vulnerability, psychological vulnerability. How satisfied are they with their finances? Are they helping anyone on a regular basis? And so forth. Now, whoops, this looks like a repeat. Sorry about that. Okay. Now I want to turn it over to Maggie. And what Maggie's been doing, Maggie is an MSW social worker with lots of experience, and she's been looking at each case, over 500 that have been administered in the last year or so, and determining whether they were appropriately administered or not. And she's just going to give some examples of these kinds of cases. Go ahead, Maggie.
Thank you, Dr. Lichtenberg. Hi, everyone. Thank you so much for having us. I want to turn your attention to our first slide here, and we'll begin by looking at the example on the left. So with these examples, we'll be going over, certain key factors that constitute appropriate versus inappropriate use of the scale. So with the example on the left, you can see that a financial decision was made, and that is turning over bill paying to someone else. So because of that being reported and noted, this would be an appropriate use of the scale. Now let's go over to the right. Now, in the instance of this example, if you go down, you can see in the notes that the interviewer noted client was unaware of a stolen checkbook. So in this case, there was no financial decision that was made. Now, I do want to note a little caveat here that with the first question, the older adult reported or chose the option of scam, fraud, and theft. So based on that information alone, we're unable to determine just yet whether a financial decision has been made. So that's why it's important when you go through to add in notes, because sometimes, in the beginning of the conversation, obviously we don't have all of the information, but as we talk and go further along in the conversation with someone, we find out some really key information. Next slide. So here is another example of an appropriate use of the scale. Another key factor, which is when you're administering the scale, you want to respond based on what you know and what you believe. So we look down here. I'm going to draw your attention to question 2. And it asks, was this your idea or did someone else suggest it or accompany you? Now, the older adult responded with someone suggested / accompanied. And there's a note there that says reported it was family member's idea and client's idea. Now, the interviewer is not agreeing with that. They're saying that it was primarily the older adult's idea. Now, again, they did note that there was possibly some persuasion by others, which is important. And as we all know, working in the human service profession, the more information, the better. And if it didn't, if we didn't note it or didn't type it, report it, if it's not documented, it didn't happen. So it's important to, again, to have those notes even along with your answers, your responses. Next slide. All right, so we have here another example of inappropriate use. And this one is very key. So if we're not able to determine deficits around decisional capacity if there's not a acknowledged financial decision. So if there's no noted informed decision that was made, coupled with insufficient notes. So again, sometimes, in the beginning, especially if it's someone we're talking to for the first time, they may not be as forthcoming. So it's a possibility that even if they did answer at the beginning, don't know or inaccurate response, that later on in the conversation, further down in questioning, they may disclose some information that reveals that they did in fact make a financial decision. However, in this example, you can see that don't know or inaccurate is the response to all of the questions. I was only able to copy up through question 5, but don't know inaccurate was also noted for the remainder of the questions as well. And then the second key factor is the notes. So the interviewer notes the client has not been exploited. The client has a guardian to make sure he is not exploited. Now that may in fact be the case, but as someone looking at this who has no knowledge or background information I would not be able to determine whether or not this individual has cognitive deficits that impact their ability to make an informed decision, or whether or not they've been exploited. So it's really important that when you're filling these out, you expand on questioning if necessary and notate all of the individual's responses in order to get a full picture of what's taking place. And I picked this specific example because I've noticed in reviewing a lot of the scales that people are looking and viewing the questions from the lens of exploitation. So did exploitation occur or not occur? And it's important to remember that with the financial decision tracker and the other scales, although that's very important, we're looking at the primary focus is the individual's cognitive capacity, which, depending on the results, may indicate, based on their cognitive capacity, a higher risk level for financial exploitation that may result in financial exploitation. So really differentiating between the two. All right, and that's it.
Thank you very much, Maggie. Really appreciate that. I just want to go through a couple of case examples before we open it up for some conversation and questions. This is a romance scam, number one. So what decision are you making or have made? And the older adult says, well, I don't know. And the interviewer says, no, I don't agree with that. This is a scam. He doesn't want to admit it, but he's being heavily influenced by a much younger woman. And you can see that not every question is going to be inaccurate. So whose idea was this? Well, somebody else's. And actually, it was his son's idea. And his son and this woman seemed to be in cahoots a little bit. And so when we look, however, at understanding and appreciation questions, we start to see more of the deficits for informed decision making. How will this decision impact you now and over time? He chooses no impact. However, it's going to have a negative impact, maybe even put him in some significant debt. Financially restricting and overall detrimental is what the note said. How about appreciation? How much risk is there? So low or no risk, and the APS worker said no, at moderate risk. He's already doubled the spending he had been doing prior to becoming involved with this woman. This is fantastic documentation for the case, and you can see it justifies why the rating was made. Who benefits most? I do. No. So this happens a lot in this understanding question. You know, I'm getting the attention of this young woman. Well, you may be benefiting by that, but who's benefiting the most financially? She is. We can see the risk score was an 11, which is a major concern. So there was evidence for deficits in informed decision making. The second one is a major purchase. And this client is purchasing a vehicle. And, you know, it might have been his idea, might have been his son's, but he doesn't really know why he's doing it. And his primary financial goal is to earn money, which makes no sense because any of us know that once you drive a vehicle off the lot, it depreciates. You can see here, one of the mistakes that the rater is making is that they are saying, as a rater, do I agree with his answer? In other words, do I think this is how he thinks about it? And that's not what we want. To be accurate, we want to say, is this the most accurate response? That's really what the rater is supposed to be doing, is looking at the accuracy. Even still, despite that mistake, there's deficits in understanding and appreciation. Again, he thinks it's going to improve his financial position, but of course not. The amount of debt with his potential income, it's not going to work out. And then low risk, but really it's moderate risk. And will he have enough money to make the payments? We see this a lot in co-signing on things. People not realizing that, yeah, you know, your grandson may be a great guy, but he doesn't have a job or any income. And if you sign that, you're going to be on the hook for it. And you really don't have the money to purchase it. And again, will it impact anybody? So you can see some of the deficits here. Who benefits most? He does know. This vehicle purchase, his son would be using it. This is, again, an example, I think, of financial entitlement. The son says, hey, I have to take dad now to a doctor's appointment, so I should really drive around in a new SUV because that'll keep dad comfortable. Of course, the rest of the time I'll have to use it for my own situation. So we'll spend dad's money, an exorbitant amount, so I can have the most comfortable car for my own uses. Again, major concerns. Now, the last thing that I want to talk about is a different program that we have that comes out of our work with financial exploitation. It's called the SAFE program. And it's patterned after a program in the Lifespan program, Rochester, New York. And it's really both an educational and a one-on-one financial counseling service to help older adults recover their financial footings after being victims of scams and identity theft. We also do a lot of public presentations. Obviously, with COVID-19, we're doing those now through different medium, virtually, but we're also, it took us to a virtual kind of financial coaching model, which is actually working pretty well. So I wanted to make sure that we bring that up because we could think about partnering with Wisconsin with the SAFE program as well. So we've already, our social worker, Latoya Hall, has already counseled over 100 older adults one-on-one and either saved or returned close to $100,000. About 50% of people get some financial benefit. But interestingly, because we do research, we've looked at their anxiety and cognition and function, and it's improved those as well. These are the kind of things that you know, most people don't have time to help an older adult do because these things take time. Filing police and consumer reports, contacting credit reporting agencies, disputing information. And a lot of older adults just don't have the wherewithal to do this. And so we're happy to work side by side with them. So we have a publication that took a look at the SAFE program. And here's what I wanted to show you. These financial decision making, this is the full scale. You can see that those who were in the control had much lower risk scores than those who were in the exploited group. They also, these other variables are significant too: depression, anxiety, Trails B, which is a cognitive test. And it really goes to show that people who are exploited are often experiencing problems across multiple dimensions. And so our counseling, financial coaching piece also seems to help reduce a lot of their anxiety. So, you know, we really kind of underscore the fact that sometimes older adults can't work their way out through this, and that it's really important to assess all clinicians and intervene basic financial matters. Clinical gerontologists really need to understand the fact that it's one dimension of several that are impacted. So I'm going to end there. Let's see here. And stop the recording.